When I close my eyes, when I think about things I could have missed out on, I see my family, my kids, Theo and Oscar, my wife, Fiona, the summer that we got to spend together. I mean, I would have missed out on just being with them. It was a morning, like early morning. I had gone to the bathroom, and the next thing I knew, I was on the floor. The dogs were barking, and my kids were there, and then my wife came, said, I'm calling 911. The paramedics hooked me up and saw the irregular rhythm and just said, we're going to Oakland. Right there, that probably saved my life.
When Chris came to the hospital, he was having a very severe type of heart attack. He was as sick as a patient can get. It was extremely dire for him. He was emergently taken to the cath lab and found to have 2 blocked arteries and treated with 4 stents. And unfortunately, 24 hours later, suffered a very complex complication of his heart attack.
Chris's heart attack was so big, it had completely killed off one of the muscles inside the heart that connects to a valve. This valve was not able to close, and the blood in the heart was all flowing backwards. He was in cardiogenic shock and was imminently going to die. Sometimes we can repair the mitral valve, but when there's a full rupture, there's nothing to repair. So we replace the mitral valve. The vast majority of cardiovascular patients, we employ 1 or 2 techniques to get them to survive. In Chris's case, every single thing that we can offer was offered to Chris during his admission here.
When someone in the hospital gets that sick, a lot of different teams have to come together. We have several nurses, the cath lab staff, or interventional cardiologists, CT surgeons, advanced heart failure like myself, and that's the purpose of having a multidisciplinary cardiovascular team. Sutter Health bringing such high level of cardiovascular care to the East Bay community really speaks highly to what the people here really want to do. It's not just about the patient, it's about their family and the lives that they touch, the change and the difference that they make in their community. Oftentimes patients, they don't have memory of what happened to them. So one of the nurses decided to create a journal for Chris to capture key moments in his recovery.
5 nurses, 3 doctors, and a respiratory therapist at her bedside to help stay. I do remember that. Yeah, I do remember I remember. I'm so grateful because I was all over that hospital. And right down the line, everyone was fantastic. One of the ICU nurses, Stephanie, got this. They signed it. Kind of a small, very thoughtful gesture. But this means so much to me. I can't even tell you.
See how the function of the heart is now actually squeezing?
Yeah.
It wasn't before?
Right.
So we've made a lot of progress, actually. You're doing much better.
I feel really energized now to keep going. Right now I see Fiona and Theo and Oscar. But because of the experience and because I lived through it, I see things differently now. There's an opportunity for me to be a better person, be impactful in a positive way. So all the people that cared for me, they'll be proud of me. I want them to know that it's worth it.